Hey guys, it's Ricky J again. Wouldn't it be sweet if I was Morgan Freeman, though? I'm just saying. Pneumoconiosis refers to an interstitial lung disease caused by the inhalation of organic and inorganic particulates. We'll be focusing on 3 mineral dusts in particular: coal, silica, and asbestos. Pneumoconiosis triggered by one of these bad boys nearly always results from exposure in the workplace. Take a deep breath. Go on. You feel that? That's progress filling your lungs. Industry, innovation, some metal fillings perhaps. Yep, we're right at the tail end of England's Industrial Revolution. And what better setting for learning about the effects of mineral dust exposure than a shipyard? All right, see the governess's tight, restrictive corset? It's our recurring theme for restrictive lung disease, which is characterized by reduced lung compliance and reduced lung volumes. Yep, that chest restriction is keeping all her volumes low, specifically the FEV1, FVC, and TLC. In this scene, we're going to be putting some serious restriction on the lung by causing pulmonary fibrosis. But as we saw in the last video, we need some kind of trigger. Something needs to sneak in there and start that initial wave of inflammation. In the setting of pneumoconiosis, it all starts with inhaling a few seemingly harmless mineral dust particles. Let's follow the path of those dust particles as they travel through the airways. Take a look at the conveyor belt unloading the coal on the dock. With each division, imagine the airways inside the lung dividing and getting progressively smaller. How far a particle progresses before it's trapped all depends on its size. A larger particle that's about 10 to 15 microns in diameter will get trapped pretty early. Way up there in the upper respiratory tract, in fact. Your lungs don't even see it. Particles that are 5 to 10 microns will most likely not reach the distal airways and are cleared by mucociliary transport in the trachea and bronchi. Just sweep it out. The particles you need to worry about are about 1 to 5 microns in diameter. Take a look. These particles go down your trachea, through the bronchi, all the way past the bronchioles. But before they reach the alveolar air sacs, they get caught at the bifurcation of respiratory bronchioles and alveolar ducts. These particles are phagocytized by macrophages. See? Those coal particles stuck at the bifurcations are transported to those cages. At Sketchy, when you see a macro cage, think macrophage. Really, really small particles, by the way, are usually not too much of a problem. They're so small that they stay suspended in the air and can move in and out of the alveoli without getting caught. In and out. So back to those macrophages. They've gobbled up the dust, and now it's time to tell everyone about it. That means releasing cytokines, which, in this scene, means dropping some cytocoins. Cytokines, such as platelet-derived growth factor and insulin-like growth factor, play a major role in stimulating fibroblast proliferation and local collagen deposition. Gah! Collagen in your lungs? Ew. No. That shark tattoo is a recurring Sketchy symbol for cartilage. And when activated, lung fibroblasts go crazy laying down the cartilage. You eventually end up with lung fibrosis causing restrictive lung disease. This is the basic mechanism that underlies the pulmonary fibrosis seen in our next 3 interstitial lung disorders: coal workers' pneumoconiosis, silicosis, and asbestosis. One more thing. I'm sure it's not surprising to hear that adding tobacco smoke on top of all of these inhaled particles can lead to even more inflammation, more fibrosis, and worse lung function. All right, enough jibber-jabber. It's time to get our lungs dirty. First up, coal workers' pneumoconiosis. It actually takes a lot of coal exposure to develop this disease. Most inhaled coal dust, remember, ends up getting trapped in the mucus and rapidly removed by the cilia. Some of these coal particles, however, become impacted at the alveolar duct bifurcations and are engulfed by macrophages. It turns out that we can see evidence of these macrophages on histology. The lungs of a patient who's chronically exposed to smoke or coal dust will look discolored and dark. This is called anthracosis, kind of like the dark coloration of a black panther, if you will. Panther-anthracosis. Just rolls off the tongue. This dark coloration is actually caused by all the little macrophages who have gobbled up dust particles throughout the lung. You'll see long, dark streaks that represent the migratory path of dust-laden alveolar macrophages along the pulmonary lymphatic vessels. Hence the streaks of coal dust visible throughout the pulmonary sails in the back. These dust cells will also be found within the draining lymph nodes, like the hilar lymph nodes. This is depicted by these two macrophage macrocages filled with coal and hoisted up on each side of the mediastinal mast. By the way, this is not coal workers' pneumoconiosis, and this is definitely not the classic black lung that you've heard about in the movies. Anthracosis is a completely asymptomatic and benign finding. Today, it's most commonly seen in people who live in large cities or in those who smoke. Coal workers' pneumoconiosis is different. In these patients, long-term high-level exposure to carbon dust causes chronic inflammation. That's the key difference here. Chronic inflammation eventually leads to pulmonary fibrosis, which is represented by this fibrotic lung-shaped piece of coral, peeking out of the water under the dock. Coal workers' pneumoconiosis involves a spectrum of disease. It's described as either simple CWP or complicated CWP. Simple CWP is characterized by dust-laden macrophages aggregating together to form coal macules. In addition to focal areas of collagen deposition and fibrosis called coal nodules. The most important thing you need to remember is that these lesions are found predominantly in the upper lobes. That's why only the top of the lung coral is poking out of the water, exposed to the coal dust from the factory above. And yes, you can see this on X-ray. Look for small, rounded opacities in the upper lobes. At Sketchy, whenever we want to highlight pertinent X-ray findings, we'll always include our recurring X-ray pirate flag, of course. Chronic inflammation eventually leads to destruction of lung architecture, leading to a centrilobular emphysema. Recall from our COPD roller hockey sketch that centrilobular indicates a more proximal destruction and dilation of the respiratory unit, while the very distal alveolar segments are spared, as depicted by our recurring emphysematous pink pufferfish. In about 10% of patients, coal nodules coalesce over many years, eventually forming huge blackened opacities in the lung, along with massive fibrosis. This is now dubbed complicated CWP. Again, this has a predilection for the upper lobes. Check out this patch of fibrotic lung coral, crushed by those massive blackened opacities from the factory. This is the dreaded black lung disease. It's marked by progressive pulmonary dysfunction, which can lead to pulmonary hypertension and cor pulmonale. And with that, let's talk about sand. I don't like sand. It's coarse and rough and irritating, and it gets everywhere. Silicosis is the most common chronic occupational disease in the world. Silica, like coal, can get lodged within the airways and start an inflammatory reaction, which is followed by fibrosis. Are you seeing a common theme here? You can get exposed to silica in foundries, mines, or from the sandblaster guy. Not really sure what that's accomplishing. Quartz, aka crystalline silicon dioxide, is the most often implicated crystal in silicosis. This is because quartz is particularly fibrogenic. Silicotic nodules form in the upper lobes of the lungs. So, just like in CWP, you're going to see those first stages of fibrosis at the top, as depicted by another fibrotic lung coral. Its top half is exposed out of the water and blasted by quartz dust. You can see this on X-ray too, as a fine nodularity in the upper lobes. Imagine fine grains of silica dusting those upper lung fields, innumerable, sharply marginated, small rounded opacities. If you take a look at one of these silicotic nodules under the microscope, you'll see concentrically arranged collagen fibers. This world appearance is embodied by this world conch shell, held by Angela Lansbury over here. You can also look at the nodules under polarized light, which will reveal weakly birefringent silica particles. At Sketchy, birefringent means birefragrant. Silicone. As the disease progresses, the nodules coalesce to form large scars. Between areas of scarring, you might also see areas of fibrosed, cystically dilated airways, also called honeycombing. See the resemblance? The hilar lymph nodes may become fibrosed as well. On X-ray, this shows up as eggshell calcifications, a thin layer of calcium over a non-calcified center. Just think of these thin, calcified shells sitting in the hilar region of the pulmonary coral. Whoa there, tiny sheriff. Why the macro cage hate? Recall from Sketchy Micro that an acid-fast, gunslinging cowboy is our symbol for mycobacteria. Well, in this scene, this hyperactive mycobacterial cowboy-clad youngster should remind you that silicosis increases the risk of tuberculosis infection. This may be due to inhibition of cell-mediated immunity. Crystalline silica may also directly inhibit the ability of pulmonary macrophages to kill phagocytized mycobacteria. In the setting of a pulmonary TB infection, nodules of silicotuberculosis can form, containing a central zone of caseation, just like these central zones of corrosion here on the side of the ship. All right, time for the last hazardous factory dust, asbestos. At Sketchy, asbestos exposure is always represented by pink asbestos-ridden insulation. Though, now I'm hungry for a Neapolitan ice cream sandwich, for some reason. I don't know why. Classically, asbestos is found in the insulation around pipes of old naval ships. Asbestos can also be found in roofing material, plumbing material, ceiling tiles, and floor tiles from 30 years ago, which means fibers can get released during building demolition or fire. Asbestos is what's called a crystalline hydrated silicate, and it comes in two distinct shapes. There's serpentine, which is curly and flexible, like an overcooked rotini noodle. And then there's amphibole, which is straight, stiff, and brittle. We've got both curly and straight in the box back there, represented by amphibole nails and serpentine screws. It's thought that the straight amphibole fibers are more pathogenic than those slinky serpentine ones, because when they enter the airway, they align themselves with the airstream and are delivered deeper into the lungs before penetrating epithelial cells and heading to the interstitium. It gets right up in there. A little too in there. Calm down, dude. Despite this difference in pathogenicity, both fiber types can cause asbestosis, a pneumoconiosis characterized by slow, progressive, and diffuse pulmonary fibrosis. Remember, though, asbestos can cause way more than just interstitial lung disease, including fibrous pleural plaques, primary lung carcinoma, and mesothelioma, but those will be covered later on in the course. We're going to briefly run through asbestosis specifically and compare its features to the other mineral dust pneumoconioses. It's the same old story. Fibers get stuck at those respiratory bronchial bifurcations and are gobbled up by macrophages, triggering a cytokine party of inflammation and fibroblast activation. However, there are a few clinical and histological features of asbestosis that make it unique. First of all, most of the fibrosis occurs in the subpleural regions of the lower lobes of the lung. Just think of the corroded base of this old anchor here. Remember, the most common manifestation of asbestos exposure is the formation of pleural plaques. So keep an eye out for them on X-ray too. They appear most frequently on the anterior and posterior parietal pleura and over the domes of the diaphragm. So look for them at the bases. These lesions do not contain asbestos bodies and are benign. They do not progress to mesothelioma. Just think of these benign and purely decorative buttons adorning the parietal surface of the old captain's coat. The middle and upper lobes of the lung become affected as the fibrosis progresses. Large, inelastic fibrous tissue segments distort the surrounding architecture, creating large cystic air spaces enclosed within fibrous walls. And this creates that classic honeycomb pattern. All right, there's one more histological clue I want to show you. After being gobbled up by macrophages, asbestos fibers are then coated with an iron-containing proteinaceous material. These coated fibers are called ferruginous bodies, or asbestos bodies. On H&E stain, they appear as elongated fusiform rods with a translucent asbestos center and a beaded coating of iron. And if you ask me, they look exactly like little clear screws surrounded by iron nuts arranged from end to end. And that about does it. To sum up, keep in mind the typical restrictive lung disease patient, who will present with Velcro crackles, dry cough, and progressive and insidious dyspnea long after exposure. Coal-workers' pneumoconiosis is usually just benign anthracosis. However, after years and years of exposure, simple CWP turns to complicated CWP, leading to a steady decline in pulmonary function. And just like that coal dust falling, CWP is going to work from the upper lobes down, forming dust cells, perihilar infiltrates, and fibrosis. People unlucky enough to deal with sandblasting or quartz mining might find themselves in the largest group of pneumoconiosis there is, silicosis. Again, look for top-down involvement of the lungs. Keep in mind the unique concentric shape of the nodules, and especially those perihilar eggshell calcifications. Silica inhibits macrophages too, so the really unlucky ones find themselves more susceptible to TB, which can lead to silicotuberculosis and caseating nodules. Seriously, I really don't like sand. I understand you've been driven to reflexively blurt out mesothelioma every time you see asbestosis, and I'll give you a few seconds to say it. Let it out of your system. Feel better? Okay, now, mesothelioma is rare. The most common presentation of asbestosis is benign pleural plaques. Asbestosis is extra special because it works from the bottom up. And make sure to look for those ferruginous bodies. All right, we're going to finish up this chapter with sarcoidosis, a systemic disease that gives you lung soccer balls. I mean, granulomas. I've heard it both ways.